Hello, I'm Dr. David Pate, President and CEO of St. Luke's Health System. I'm glad that we could spend some time today to update you on things that are going on at St. Luke's Health System. We heard loud and clear from both our employee and physician surveys that you want to understand more about what we're doing. What are senior leaders thinking? What's our strategy? What are our plans? What are we thinking about the future? So we've committed to a lot more communication, and forums are part of that commitment. We're doing 2 forums a year now. We do one set in the spring where we go to all the entities, and we're looking forward to what are we going to be doing that year. And then we'll do a second set in the fall, which is really kind of the state of the system and looking back at what have we accomplished and where are we positioned. In addition to our forums, I'm really excited about my blog, Dr. Pate's Prescription for Change, and I hope you're following that blog. I'm trying to role model transparency. We make this available to everyone, and in fact, we've had almost 10,000 visits to the blog and over 5,000 unique visitors. There you'll learn all kinds of things that I write personally about my thoughts on contemporary issues, such as what do I think about the Supreme Court decision involving the healthcare reform bill? What do we think about, is healthcare a right? What is our strategy? What are some of the initiatives we're doing and why are we doing them? And lots more information there for you to learn about what senior leaders are thinking and why we're doing the things that we're doing. Additionally, today on my presentation, all of the quotes used on the slides are from some of the postings or some of the comments that people have made on the blog. In addition to the forums and to the blog, we have Channel 1, and that is a real innovation in communication. There we are doing high definition, short duration videos that we push out to you to help keep you posted on the latest things that are happening around the health system. So I want to start today's talk, and I want to talk to you about the things that inspire me. The triple aim, our community, and our employees and physicians. So let's start with the triple aim. We announced in February of this year that we intend to participate in the Medicare Shared Savings Program. Now, what's significant about that is Medicare is offering a program where we can align around the triple aim. And in fact, if we lower costs while hitting all of the quality targets, we can share in those savings. So now this is a movement in the right direction to get away from fee-for-service to pay-for-value. We seek to provide accountable care to everyone, every day, in all of our payers, not just Medicare. And if you look on my blog, you'll see an article about what you can do to help us achieve accountable care. And we're already making tremendous progress. I'm so proud of what everyone in this organization is doing and what we're achieving. For example, on the triple aim, which I talked about is better health, better care, and lower cost, we've already made progress in what I think is the most challenging of those, and that's how are we going to improve health. And yet we're already having great success here with our Healthy You program. We're walking the talk. We've got 91% participation among all of our employees, and already, and I haven't even gotten the results of the full first year, but it already appears that we've lowered high blood pressure, pre-hypertension, diabetes, and pre-diabetes, each by more than 10% among our own employees. That's huge. We're making a difference. And what's so important about this is as we prove what we can do with our own employees, we can go to other employers and say, this is what we can do to help you, to help your employees be healthier and more productive. So it really gets at where the future lies for St. Luke's. Today, we're a company that provides ill care services. Tomorrow, we need to be a wellness company. We need to be a company that promotes health And we also have hospital services and all for those that are ill. Our biggest objective, if we really want to lower costs, is we've got to prevent people from becoming patients, because by the time they become patients, it's too costly. So we're focused on that to reduce costs, but we're focused on a lot of things internally to St. Luke's to reduce costs and make sure that we're doing our part to make healthcare more affordable in Idaho. So we're focused on process improvement and efficiency. Our system chief operating officer, Gary Fletcher, has many teams across the health system that are working on things like supply chain management. How do we lower the cost in our supply chains? Because there's huge opportunity there. And our own St. Luke's implementation of Lean, which we call teamwork. And the team in teamwork stands for timely, effective, accountable, and management by metrics. And we're already implementing teamwork across the health system. We've made tremendous impacts in laundry, pharmacy, blood utilization, OR operations, all kinds of areas where we can drive out waste that's not contributing to better care or being able to deliver the care in a better way. Now, on to better care. We've also made tremendous progress in that area, and it makes me so proud of everyone for all the roles that you play in delivering better care to our patients. And we got external recognition this year. Thomson Reuters recognized as one of the top 50 health systems in the country. That's amazing. We haven't even had our 6th birthday as a health system yet, and look at what already we're achieving. And we're achieving that by working together. That's the value of being a health system. We have so much more that we can accomplish when we all work together than we can in our individual hospitals and clinics and physician offices. Additionally, health grades. We made huge progress in terms of how the objective ratings about our mortality and complication rates. And if you look on my blog, you can read a story where I outline what those accomplishments were and some of the accomplishments at each one of our entities. I'm so proud of the work that all of you are doing. And keep in mind, this is translating into lives saved. People that are alive today that statistically would not have been before. That's huge. And just a few days ago, we received an award from Qualis for our success in reducing sepsis mortality, a very high mortality rate condition, and we're lowering that. We're getting more people saved from that terrible problem. So great job. I'm so proud of you. I'm also inspired by the level of support that we enjoy from our communities. All of our volunteer commitments. I'm amazed by the number of volunteers, people that commit their time to helping us in so many different ways that relieves a tremendous burden that we would otherwise have to provide. The volunteer boards. We have over 90 board members across our health system, and they are tremendously engaged and committed to helping us be successful to transform healthcare. And we're getting record philanthropic giving, and that's going to be especially important at a time when we change from this fee-for-service environment to pay-for-value to how we're going to have the money necessary to invest in our ongoing operations, our technology, our facilities, and our people. So this is so important. I also am so inspired when I hear about how we're now impacting generations. So as an example, I needed help with an IT matter, and Tracy Morris came to help me. And while he was working on my computer, he said, "St. Luke saved my life twice." And I said, "Well, how is that?" And he explained to me how when he was 5 years old, he had surgery for coarctation of the aorta over at our Boise hospital, and it saved his life. And he told his parents, he said, "I'm going to work at St. Luke's one day." And then as he grew up and he became an expert in IT matters, he applied to our IT department. He's now with us. And I said, well, that's super, but how's the second way that we saved your life? He said, during Healthy You, it was discovered that he had diabetes and he had no idea. So with the resources that we offered through Healthy You, he lost over 100 pounds. And he told me that his diabetes was gone in 3 months. But not only that, not only did it impact and change Tracy's life, but his family's too. His wife now has joined with him in regular exercise, and she's lost weight. So we're improving the health of families. So that's so exciting. There was also a great story on Channel 7 about our NICU here in Boise. And then I had the opportunity to meet someone who had been a NICU patient and now is an NICU nurse. That's amazing how we're impacting generations of people. In addition, I constantly get feedback from our community. I speak frequently with communities about what we're doing and how we're facing up with healthcare reform. What are we doing and how are we going to tackle that? And I get feedback from the communities about they're so excited that St. Luke's isn't just complaining about the healthcare reform law and all the things that are going on, but we're actually taking charge and we're presenting solutions, and they're really excited by that. So that's wonderful. We have some great long-term leaders. I have long-term leaders on my team: Gary Fletcher, Jeff Taylor, John Key, Maureen O'Keefe, Rich Holm, Jeff Seelig, Christy Newhoff, Adrian Edens. We have so many people that have been here for a long time. And I know all of you work with people who have been working here for many years. I had the chance to visit endoscopy and meet some people there that have been working for us for 20, 30 years. I mean, that's wonderful. And that's our conscious and that's our institutional memory. But with that great foundation, and I've talked about many times about how I was attracted to come here to St. Luke's because of the incredible foundation all of you have built. But now we're trying to get to the next step, and so we're implementing new ways of doing things to add to that foundation that's already put us out ahead, so that we can take new approaches to how are we going to lower costs, how are we going to improve efficiency, how do we standardize and reduce irrational variation throughout our health system that only increases the chance that we'll make errors or adds to cost, and how do we share best practices around the whole health system. So these are the things that are going to take us to the next level. Additionally, I am so inspired and impressed by the number of physicians that we have that are stepping up and taking leadership roles. And we're providing leadership training to them to help them be more effective physician leaders. It is a critical time for us to be physician-led. That means that we have to have physicians as our partner to be successful. That doesn't diminish the role that everyone else plays. In fact, the roles for others are not only changing, but becoming even more important as we move to team-based care, which is really going to be the secret sauce. That's how we're going to make really marked improvements in what we're doing. This means including nurse practitioners, physician assistants, nurses, therapists, nutritionists, social workers, so that we have a whole team to address those patients that are the most complicated, most resource intensive, and are driving up the healthcare costs. Because if you look at where the healthcare costs are spent, 80% of the healthcare costs are spent on maybe 5, maybe 10% of the population. That's where we need to focus. And so with it, as we apply team-based approaches, we're even going to have new roles emerging. We're going to need people to fill roles as health coaches, like what we're doing with our Healthy You. Now we've got to extend it to our patient population. Health navigators, so we can coordinate transitions of care and make sure that people don't drop between the cracks. We have to have more educators. We have got to figure out how to better educate our patients and their caregivers so that they can engage in their care and so that they can be part of solving their healthcare challenges. In the fee-for-service world, We used to be able to just be focused on providing care and didn't have to spend a lot of time thinking about the direct consequences of the costs. But today, as we transition to pay for value, we have to be leaders in all three parts of the triple aim: that better health, better care, lower costs. Because we have to be able to do these things if we're really going to control the healthcare costs. We're not doing this because of the healthcare reform law. We're doing this because it's the right thing to do, and it's how we're going to transform care and make it more affordable for our communities. So now I want to talk to you about, I often get asked, what are the things that keep you up at night? Well, I'm going to cover three different areas. I'm going to talk about the need, I'm going to talk about the competition, and I'm going to talk about the nature of change. So with that, let me start with the need, and I want to be very clear. We are facing a far greater challenge than we even face today, and that's because of the epidemic of childhood obesity, the chronic disease that's in the pipeline coming to us because of that: diabetes, hypertension, high cholesterol, heart disease, arthritis, and even now some evidence showing correlations between certain types of cancer and obesity. So lots of chronic disease coming our way. Even if we started with accountable care full blast today, there's going to be disease coming our way for years because we can't turn around all of this, and not everyone will be part of improving their health. In addition, in 2014, unless the healthcare reform law is overturned or repealed, the role of Medicaid enrollees is going to increase by 50%. So that is going to put a tremendous strain on the system. And that's why, even if we are implementing accountable care today, we're still going to experience growth. And the population is growing. And for all these reasons, that's why we're still going to need certain new facilities and more facilities. You can read more about this on my blog, too, to understand what are the challenges that we're facing. And that's another reason why we're going to need team-based care, because we're not going to have enough primary care physicians to deal with all of these new patients, and especially the new Medicaid patients. There's already a primary care shortage in Idaho. In fact, we're ranked at one of the lowest among all the 50 states. We have to find ways to be able to deliver care to more people so that we can really manage populations of patients. The only way we're going to do that is to develop teams where we don't have to be totally dependent upon physicians to provide all the care. We can now do it with a physician leading a team of people that will devote these resources necessary. So let me comment on new competitors. About a month ago, I went over to a Borders bookstore. I love books, and they were closing. And so I was looking to see what kinds of deals and books they might have. And why they were closing is because of the transformation that's already occurred in that industry. Now you've got Amazon Books, Kindle Books, Google Books, and it's really hurt that business. So now you're not going to see Borders across the country. And you can look at other examples as well. I remember when my kids were young, taking them to Blockbuster to rent videos. Well, now there's Netflix. And in fact, Netflix put Blockbuster in bankruptcy. And now there's Redbox, where you can go get your movies at the grocery store. But it's not just these other businesses. It's impacting healthcare, and we've seen these changes. I remember when I was in practice and I had a pager and it would go off, I'd have to pull off the road to go find a payphone. Well, you can't even find a payphone these days. Now we all have cell phones. But when they first came out, I had a cell phone about this big that I had to carry around. Now the cell phone fits in my palm. Many of you that are listening to this will remember having patients in the hospital for 3 to 5 days to have their gallbladder out. Now that's routinely done as an outpatient. And you've seen the emergence of robots. We've got robots in surgery now. We even have robots in the pharmacy, and robots are being used with telemedicine and all kinds of new ways. So there's transformation occurring in healthcare, and we've all seen it in our lifetime, but it's nothing compared to what's coming. And if you think about it, let's imagine that everybody listening to this video today was on my board. And let's say we were making kitchen appliances, and I was giving you a report that when we make these kitchen appliances, what's happening is it's inconsistent quality. Some of them break, some of them aren't as good. And also, some of these kitchen appliances are not very safe. In fact, we've even hurt some of our customers. And that the people that buy our kitchen appliances are saying it's too difficult to get them. They can't get them, find them in every store, they can't order them online, and when they buy them, they're too costly. Now, if you all were my board of directors, you would be panicked by this. You would be saying, oh my gosh, we're going to go out of business. We've got to change. And that's what is actually can be described about healthcare. It's not consistent quality. We are hurting some people. It is difficult to access, and it's too costly. And if we don't find the answer, then somebody else is going to. It's not St. Al's that I worry about. It's new emerging people that are going to do healthcare in a completely different way. And one example is Walmart. They're coming out with some very new approaches, and they're going to be into healthcare. But there's many other companies, and so that's why we have to be part of making this change. We can't just sit back and bury our head because others will solve this problem if we don't. Now, I know change is hard, and it's uncomfortable. But we have a relatively easy choice because the choices are we can lead that change or we can sit back and try to resist, and we will be changed. It may be a disruption like what I was just talking about, where a Walmart or some other company comes in. But if not, we know how our government has always handled the challenges that face us in healthcare. They just continually cut fees. And there's a limit to how much we can take. We've got to find a better solution. And we're already feeling some of these changes that are happening. We've been impacted in our own volumes and financials. We have to change. The time is now. We can't sit back because the people of Idaho are counting on us. We have to come up with a solution. So now I want to talk a little bit about our strategy. And I want to talk about the philosophy and the alignment efforts that we're making. And then finally, I'll end up with what's the bottom line. So our strategy is accountable care. It's better health, better care, and lower costs. And part of accountable care is accountability. And accountability is the center point of our values, the I care. That's the A in I care. And we have to do this. And it's not just for us, but it's for the whole state. As the largest employer, we understand the impact we have on the Idaho economy. And if we can fix what's wrong with healthcare, and if we can make people healthier and better care, we can attract more businesses to Idaho and attract the ones that are already here. We already have fairly low costs in the country, but if we can do even better, then that will give businesses a competitive advantage. The other thing is, I want to have the healthiest communities in this country, and there's no reason that Idaho shouldn't lead this. But right today, we don't have the healthiest communities. So how are we going to get to better health? Well, it's a lot of things. We have to approach better health by looking at populations of people. We have to go out and do a lot of health screenings and then identify who are those high-risk individuals. Remember what I talked about, that we need to focus on those at highest risk or who are already using the most of the healthcare resources. And then come up with targeted interventions. How are we going to help decrease the risk for those individuals and help them be healthier? It's all going to be about prevention and better lifestyles. And we should be encouraged, because we have two things going for us. We got the healthy you, and we're already showing what we can do with our employees. We can do this with the rest of the populations that we serve. But also, we created the Center for Healthcare Innovation, and we're looking at very new ways of helping activate patients to be participants in their healthcare. And I hope you've read on my blog the piece that Tony Tomasic wrote about what he's doing in healthcare innovation. And then better care. How are we going to do that? I've already talked about team-based care. In addition, we've got to manage transitions of care. Every time a patient moves from one part of the health system to another, or even outside our health system, there's a chance for a breakdown in the care. And we have to manage those transitions. We have to be able to provide services to people throughout a lot of rural areas. We're going to need telemedicine. We're going to need to also be able to manage the care of patients in other settings that are less costly. For example, their homes. So we're going to need home-based monitoring. And we've got to apply evidence-based care throughout our health system. I'm so excited about what we are doing with Epic. Adrian Edens and Dr. Mark Chasen have done a phenomenal job leading many teams of people who have just done a fantastic job. So Epic, but also clinical integration, and John Key and Dr. Kurt Seppi and Dr. Jeff Swanson have been leading these efforts to get physicians working together so that we can provide coordinated care that's better care at a lower cost. And lower cost, we've been doing a lot of things, as I've mentioned, reducing waste. And waste can be duplication of things, and by implementing Epic, we can help make sure that we're not duplicating more tests than we need to. Inefficiency is a waste we've got to eliminate, and we've got to eliminate low-value services. We've got to provide the right care at the right time, and we have to do it in the lowest cost settings available. So let me talk about alignment for a minute. Over the last 3 years, we have focused on aligning us around the system, that we can leverage the abilities and the capabilities of the health system by all working together. We become one St. Luke's. And we're talking about alignment with physicians through clinical integrations. Physician working together across the system interdependently to apply evidence-based medicine and consensus-based best practices. And I'm so proud that Dr. Seppi has formed a clinical leadership council of very impressive physicians who have stepped up in leadership roles, and those physicians are driving a lot of the change that we're having to make. So we have to change the business model, because if we're going to really focus on better health, which we currently don't get rewarded for, and better care, we got to be paid for value, and especially if we're going to lower costs so that it doesn't all just come out of the health system, but there's a way to share in those savings. So we're working on transforming that business model to support the clinical model. And that is being led by Randy Billings and Jeff Taylor. And we are making some great progress with the payers. But we're starting with Medicare, with the Medicare Shared Savings Program. And we have our own employees. We're managing 10,000 employees plus all of their dependents. So that's almost like being an insurance company itself. So these are efforts where we can go ahead and apply what we're doing and learn from it and help to manage these populations as we now go to the commercial market and try to do that with the other payers. So patient-centeredness, this is a part of better care. And to do this, we've been implementing our electronic medical record called Epic, but we've branded it as My St. Luke's. And My St. Luke's is essential for building the platform for clinical integration, as well as this is how patients can access their own medical record, how they can schedule online, how they can email with their providers, and how providers can develop individualized care plans. Recently, I had the opportunity to visit the command center at the Meadow Lakes building, and I ran into Dr. Eric Meyer, and he was staffing the physician call center because he was one of the physicians that went up early on Epic. And I asked him about his own experience and how much he really likes being on My St. Luke's and how much his patients are liking it. And he told me that one of the things that he was very surprised about is how much he does like that email function and to allow his patients the opportunity to email him. We have a tremendous number of people who have been dedicated to this rollout of My St. Luke's. More than 240 dedicated project participants who have spent more than 500,000 work hours in our implementation thus far. Today, we have over 1,700 patients who are now actively using MyChart, their ability to access the electronic medical record online. This is also going to be critically important as we enter into the Medicare Shared Savings Program, because one of the requirements is for us to report 33 quality measures that are mostly occurring on the ambulatory side. So having the electronic medical record rolled out is going to make it much easier for us to gather these quality measures and report them to CMS. A lot is going on, and I understand it may seem chaotic to you. And sometimes you need a better understanding about what are all these different things we're doing. And again, I encourage you to read my blog as I try to pull a lot of this together for you. But one of the great features of the blog is that you can actually write in and ask me for questions or clarifications or other things that you want me to write about. We have a lot of things that we have to do just to keep up. The government has imposed meaningful use, value-based purchasing, e-prescribing, ICD-10, HIPAA 5010, the physician quality reporting system. I mean, it's just hard to keep up with all the things that we have to do just to comply with the current requirements. But we can't let that hold us back, because we have to be moving further ahead. If we don't, we're going to fall further behind. So what I'm excited is not only are we doing all those things that we have to keep up, but we're getting ahead. We're doing new innovative projects, new diabetes management pilots, and what I talked about before, in our efforts to bring team-based care to manage those patients who are consuming the most amount of costs, our Care of Patients at Risk project is very exciting and is going to advance our capabilities around accountable care. We are making a start, and we must. Here's the bottom line. Healthcare is unsustainable. It's not affordable. It's not high quality enough consistently. It's not safe enough. It's not convenient. We have to be part of solving what's wrong with healthcare. If we're not part of the solution, we're part of the problem. And we are going to be part of that solution. The health of our country is deteriorating. And at the same time, we're actually extending life expectancy for those who can access health care. More and more people are going into bankruptcy because of healthcare costs. And now we risk our country going into bankruptcy. This is now personal. We are talking about healthcare for our children and our grandchildren. We have to fix what's wrong with healthcare. Recently, Dr. Don Berwick, the former administrator of CMS, came to visit us at St. Luke's and gave a talk to about 300 people. And when I visited with Dr. Berwick, he confirmed that we can't count on government to fix what's wrong with healthcare. He's seen it from the government side. Government is not going to fix what's wrong with healthcare. He said it's going to be providers that fix what's wrong with healthcare. And as he read through our strategic plan and read about the specific initiatives that we're undertaking, he told me he was amazed and he was so excited. He shared some of our documents with several other people because he was so excited. And he told me that if we can accomplish, if we can implement and execute what we have in our plans, he says, no doubt, we will be a national leader. We can lead the way to fixing what's wrong with healthcare. We have very caring employees who understand that we are caring for our friends and neighbors here in our St. Luke's Health System. We have amazing leaders who are working to redesign a broken system. We have inspiring physician leaders. We have all the ingredients we need to now fix healthcare. It's the right thing to do. So I want to thank you for everything that you do. And I want you to know that it takes every single one of us. Every one of us has to do our part. And I'm so proud and so excited about what you're doing. But by coming together, by working together, by doing the very best that we can, by helping take better care of our patients and make sure that they're better educated, and by working together to reduce waste, and by working together to help make sure that we promote the health of the communities we serve, we're going to do great things. And I'm so proud to have the opportunity to lead this wonderful organization and all the wonderful employees and physicians that we have. Thank you for joining me today.